Hello, I'm Melissa Rodriguez. I'm a graduate student at The Ohio State University, and today I will be talking about the effects of different levels of vitamin A supply on production and blood parameters of transition cows. Vitamin A is an essential nutrient involved in several physiological processes. As an essential nutrient, vitamin A needs to be incorporated in the diet as mammals don't synthesize it. In dairy cattle, different levels of vitamin A are required depending on their stage of lactation. As we can see here, differing requirements for lactating dry and growing animals. These requirements for vitamin A, specifically in dairy cattle, have been based mainly on reproduction efficiency, immune system function, milk production, and the most common for maintenance of vision. More recently, vitamin A has grown interest as a hormone and approximately controls 500 genes. Vitamin A has been proven to regulate energy balance through its actions in the liver and adipose tissue. Specifically, our interest lies on this regulation of vitamin A effect in energy and lipid metabolism. Lipid and energy metabolism is under the regulation of PPARs. They're also known as peroxisome proliferator activated receptors. And the activation of these PPARs are induced in the presence of vitamin A. Upon activation of specifically PPAR gamma, one of the isotopes of the nuclear family induces the transcription of target genes involved in adipogenesis or lipogenesis, then resulting in adipose tissue remodeling. Adipose tissue in mammals play a central role in the control of energy balance and lipid metabolism. Dairy cattle around parturition undergo a period of negative energy balance due to low nutrient intake and increasing nutritional requirements to support milk production. To compensate for this energy deficit, adipose tissue is mobilized in the form of non-esterified fatty acids or free fatty acids to produce more energy for the animal. The problem arises when excessive fat and its oxidation in the liver impairs its normal function. This then leads to the production of ketone bodies, which can act as an alternate fuel to peripheral tissues in times of energy deficit. However, high production and accumulation of these ketone bodies are detrimental, as it further decreases the animal's appetite, promotes body condition score loss and body weight loss, resulting then in decreased milk production and poor reproduction, which ultimately leads to the removal of the animal from the herd. Previous studies in cattle have been conducted to evaluate the effect of vitamin A levels on the regulation of lipid and adipose tissue metabolism. However, these studies have been conducted with beef cattle. Therefore, my research is unique in its aspect of using dairy cattle to evaluate this before mentioned effects of vitamin A in adipose tissue metabolism. The objective of my experiment was to determine whether vitamin A supply, lower or greater than the current requirement, affects body fat mobilization, and we hypothesized that vitamin A lower than the requirement will reduce fat mobilization and therefore reduce the risk of ketosis. For our approach, we divided the experiment in 3 experimental periods: prepartum, postpartum, carryover. Prepartum consisted of observing the cows and collecting samples approximately 14 days prepartum into their expected calving date. Postpartum period consisted of observations and collection samples of 1 to 30 days in milk, and carryover period consisted of observations of 31 to 58 days in milk. Our measurements included daily production and dry matter intake. Weekly milk composition was also assessed. blood plasma to evaluate for non-esterified fatty acids, beta-hydroxybutyrate, which is a main ketone body, and cholesterol. Also, a blood differential count was taken at day 5 after calving. Our dietary treatments consisted of no supplemental vitamin A. Control just met the requirements for the supplemental vitamin A, and the high treatment consisted of supplementing 2.5 times higher the requirement of the supplemental vitamin A according to the NRC 2001. In terms of results, we saw that the effects of vitamin A on dry matter intake, prepartum and postpartum had no effect. Moreover, the effect of vitamin A levels on milk production, specifically in the postpartum period, which was from day 1 to 30, we saw a linear effect of milk fat content, with the highest being the high vitamin A treatment. However, no milk fat yield was different, and this difference in content and yield could be attributed to a dilution factor. And lastly, during this time, we also saw an incredible increase in somatic cell count as vitamin A increased in the diet. In this table here, we have the effects of vitamin A levels on blood plasma metabolite concentration, which were measured at day 14 prepartum, and then again at day 2, 5, 10, 15, and 30 days in milk. We did not saw any difference among treatments for non-esterified fatty acids, beta-hydroxybutyrate, and cholesterol, which all are indicative of energy balance and fat mobilization in the animal. However, we did find an average incidence of ketosis that was 21% among treatments. However, according to literature, this is well within the normal range. And lastly, we see that the effect of vitamin A on blood differential count test, taking at day 5 postpartum, segmented neutrophils tended to decrease as vitamin A increased in the diet, contrarily to lymphocytes, which increased as increasing vitamin A in the diet. In concluding thoughts, vitamin A supply lower than the requirement did not affect the rate of fat mobilization during the transition period. Vitamin A, 2 times higher than the requirement, had an effect on white blood cell count, specifically lymphocytes and neutrophils, suggesting a negative impact on resistance or susceptibility of diseases, specifically during this transition period. And lastly, the restriction of vitamin A during the transition period may not have been enough to reduce the fat mobilization that the cows experience in that negative energy balance after calving.